Harry, I've noticed a significant decline in the quality of the gloves we've been using lately. They seem to tear easily during patient care, increasing the risk of exposure to bodily fluids.
That's a serious concern, Mihira. Patient safety is our top priority. We've received similar complaints from other staff members.
I'm worried about the impact on infection control. Tears in the gloves can compromise our ability to maintain a sterile environment.
Absolutely. We need to address this issue immediately. I'll contact the supplier to discuss the quality concerns and explore alternative options. In the meantime, please ensure that all staff members are following proper hand hygiene protocols and using additional precautions when wearing the current gloves.
I've already reinforced the importance of hand hygiene during our last staff meeting. However, I think we need to provide staff with clear guidelines on how to handle the gloves to minimize the risk of tearing.
That's a good point, Mihira. We can develop a protocol for glove usage. I'll schedule a meeting to discuss this further. It's crucial that we find a solution that protects both our patients and our staff. Mihira, one of the most important things you can do is to keep Emma well hydrated. Fever can cause her to lose fluids, so offering small, frequent sips of water, oral rehydration solutions, or even clear broths or diluted juices is really helpful. Even if she's not asking for it, gently encourage her to drink. You'll also want to ensure she's dressed in light clothing. We often instinctively want to bundle a child with a fever, but light layers actually help her body release heat more effectively. Overbundling can trap heat and make the fever worse. If she feels warm to the touch and is uncomfortable, you can try lukewarm sponging. This isn't about using cold water, which can cause shivering, but rather gently wiping her skin with a cloth dampened with lukewarm water to help cool her down gradually. Of course, you can also use over-the-counter fever-reducing medications like paracetamol, always ensuring you follow the dosage instructions carefully based on Emma's age and weight. While many fevers can be managed at home, it's really important to know when to seek further medical attention. Mihira, please contact your doctor if Emma's fever persists beyond 3 days, even if it's not very high. Also, be attentive to any changes in her behavior. If she becomes lethargic, unusually sleepy, or difficult to rouse, or if she seems unusually irritable and cannot be comforted, these are signs that warrant immediate medical evaluation. You should also seek medical attention if she develops any new symptoms, such as a stiff neck, a rash that doesn't disappear when you press on it, difficulty breathing, or severe pain. Trust your instincts as a parent. If you're ever seriously concerned about how Emma is looking or acting, it's always best to have her checked by a healthcare professional. We are always here to support you.